Good morning to our guests and to all our media partners. Welcome to today's Media Forum, November 4. For today's Media Forum, Yusek Rosette will be giving updates on the DOH typhoon response, followed by a presentation from our guest speaker. Yusek Rosette.
Yes, good morning to all of you and good morning to Dr. Reese Gonzalez. Thank you po for
Hello.
accommodating our invite. So ngayong araw po, magbibigay muna kami ng update regarding a response to Typhoon Rolly. Pagkatapos, we will have our guest already. So ang latest report po galing sa aming Health Emergency Management Bureau Operations Center, kaugnay po ng Bagyong Rolly. Ayon po sa huling ulat ng DSWD, meron po tayong 576 families. 576 families or 269,507 individuals na pansamantalang nananatili sa ating 2,671 evacuation centers sa Regions 2, Region 4A, Region 4B, Region 5, the National Capital Region, and Region 3. So ang ating kagawaran ay nakapagtala po tayo ng 8 health facilities na bahagyang napinsala dahil sa bagyo. Ito po ang sumusunod. Mga DOH retained hospitals and laboratories katulad ng Bicol Regional Training and Teaching Hospital sa Legazpi City, Albay, Bicol Medical Center sa Naga City, Camarines Sur, Bicol Regional General Hospital and Geriatric Medical Center sa Cabusao, Camarines Sur, Bicol Regional Diagnostic and Reference Laboratory sa Legazpi. Mga LGU hospitals naman po na may bahagyang pinsala, Ziga Memorial District Hospital sa Tabaco City, Albay, Juan M. Alberto District Hospital sa San Andres, Catanduanes. And meron din pong isang rural health unit sa Malilipot, Albay, at yung barangay health station sa Barangay Calbayog, Malilipot, Albay. So ang pinsala po na natamo ng DOH retained hospitals and laboratories ay naitayang aabot sa 116 million. Patuloy pa rin po nating inaalam ang mga lagay ng iba pang health facilities sa lugar na dinaanan ng Bagyong Rolly. Para naman po sa lagay ng ating temporary treatment and monitoring facilities, kasalukuyan pong nananatili sa mga designated hotels and hospitals ang 155 na pasyente at 169 na staff na mga sumusunod na mega TTMFs. Ang una ay ang Ninoy Aquino Stadium at Rizal Memorial Coliseum sa lungsod ng Maynila, PhilInvest Tent sa Muntinlupa City, PICC sa Pasay City at Philippine Arena sa Santa Maria, Bulacan. Meron din pong 4 na apektadong TTMF sa lungsod ng Pasig, Makati, Pasay at Las Piñas na pansamantalang inilikas sa designated hotels and hospitals ang mga staff at pasyenteng naka-quarantine. Samantala, patuloy pa rin po ang aming assessment sa lagay ng Bicol TTMF at sa quarantine facilities sa pangunguna ng Center for Health Development Region 5. So ang kagawaran ng kalusugan po ay nakapagpamahagi na ng hygiene kits, collapsible drinking water containers, mga gamot at iba pang medical supplies, kabilang na po ang PPEs at COVID-19 supplies sa iba't ibang regional offices ng DOH. Nakapagbigay din po ang DOH ng financial na tulong na hindi bababa sa 20 million pesos sa 3 DOH retained hospitals, 6 na probinsya sa Bicol Region at sa Naga City. Patuloy po nating minomonitor ang kalagayan at ang estado ng ating mga health facilities at kung ano pa ho ang kanilang mga pangangailangan. Ang ating pong Health Emergency Management Bureau ay nananatiling nakaantabay para sa paparating na bagyong Shoni. So yan muna po ang aming updates ukol sa mga pinsala na tamo sa bagyong Rolly. So for today, we shift to our guest for today. Kasama po natin sa araw na ito si Dr. Rizalina Raquel Gonzalez. Siya po ang head ng Tobacco Control Advisory Group mula sa Philippine Pediatric Society. As part of the priority areas of the department in promoting a healthy Pilipinas, tatalakayin po niya kung paano ang kasalukuyang sitwasyon natin sa pagpapanatili ng smoke-free in the new normal. So Dr. Gonzalez, the floor is yours.
Hello, good morning po. Good morning po. I'll just slide share po. Okay, good morning po. Can you hear me na po?
Yes, doctors, go ahead.
Okay, good morning. Thank you for inviting me with this advocacy which is closest to my heart. The Philippine Pediatric Society has been active and has been working with DOH for the past 3.5 years. And we, especially for the children, are clamoring ever since before COVID. We call it the BC for a smoke-free Philippines. So this call, beat COVID, I think it is timely because this is actually one of the best preventive measures in making our country to be to have a healthy environment for all by pushing our smoke-free advocacy not only in the home, in the office, but all throughout the country. So next slide, please. Hello. Next slide. Okay, 9 months passed. That is actually where we are now. But what have we learned from this COVID-19 pandemic? Before the previous slide, please. Sorry. So what have we learned from this COVID-19 pandemic? We always say staying safe. Staying safe means staying healthy. We all have been locked down at our homes. We don't have office. We don't have much of the clinics. And then now we are reopening for our economy and actually for our COVID cases to be controlled. We still have to do the 3 Ws, which PPS has been advocating, and that is wear your mask, watch your distance, wash your hands. These are actually preventive measures geared towards our personal protection. But these are actually healthy habits, preventive healthy habits, which should be included to achieve a healthy environment to live in. So what is actually going on before COVID? We have been pushing for a smoke-free Philippines because a healthy environment can be achieved once we adhere strictly to smoke-free laws, which has always been there, but it seems not to be noticed. That is having a home, a community, and a country to be a smoke-free and vape-free. This is our campaign with the Department of Health, the Philippine Pediatric Societies, the Vital Strategies, and the Smoke-Free Philippines. Next slide. Okay, this is my favorite slide. If you're going to see that baby, that child beside, and there is this hand, that is not her hand, but that is the smoker's hand. And I am emphasizing that you don't need to be a smoker to have the health effects of the tobacco. But the second-hand smoke, there is no safe level. And this one is a smoking cycle which everyone should realize. It involves a life cycle from in utero because smoking per se, when you are exposed, can cause low birth weight, stillbirth, placental problems, neurological problems, specifically ADHD because of the effect of nicotine in the developing brain. The child, once exposed in a smoke-filled home or in a community, they are prone to have, during their infancy, SIDS, bronchiolitis, recurrent asthma, chronic allergic rhinitis, and even fire-related injuries because of the cigarette butt that has been left unattended. As they grow up, their lung function diminishes, and so there is low exercise intolerance, there is poor lung development, and unfortunately, nicotine addiction. And what happens when they are an adult? They are the ones with impaired health, the one with cancer, cardiovascular disease, COPD. What is the impact of this? During this COVID times, the coronavirus targets mostly those persons at risk. And who are those suffering from deaths? They're actually mainly those with pre-existing conditions, those with hypertension, those with cardiovascular diseases, those with severe asthma, and even cancer. You know, all of these are all caused and can be caused by smoking per se. So next. Let's look at the facts, smoking and COVID-19. Tobacco use and exposure is an all-time epidemic. Let us not put this to the side because tobacco causes 8 million deaths every year, of which 1.2 million are second-hand smokers. What is our data? 150,000 Filipinos die every year due to smoking and second-hand smoke. What is our COVID deaths as of yesterday, November 3? We have this is globally, we have 1,200,200, out of which is 46,591,622 reported cases globally. Let's compare it with tobacco use. It is still minuscule. 8 million for tobacco use every year. It is 1 million for COVID-19 deaths. How about our case? There are 7,318 deaths to date out of our 387,161 cases. So what is our question? Next slide. Is there an association between smoking and COVID? This has been studied, reviewed using the Medline, MBase, Cochrane by the WHO in May 2020. The question is there an association between smoking and COVID-19 in terms of risk of infection by SARS-CoV-2, hospitalization with COVID-19, and severity of COVID-19 outcomes among hospitalized patients in ICU? What came out is that smoking is associated with increased severity of disease and death in hospitalized COVID-19 patients. Do not forget that the smokers themselves have their bodies at risk for COVID-19 because of their risk factors. And that the conclusion, therefore, is smoking is associated with increased severity of disease and death in hospitalized COVID-19 patients. Given the well-established harms associated with tobacco use and that of secondhand smoke, the WHO recommends that tobacco users stop using tobacco. So, next slide, please. Why? Your risk of getting tobacco coronavirus is bigger if you use tobacco. Why? What our 3 W's is wear your mask. Do you smoke wearing a mask? Of course, you remove it. Do you smoke by just putting that stick in your mouth? Of course, you use your hand. And that hand-to-mouth gesture is involving opening up the portals of entry for COVID. And here you are as a smoker with a risk factor, ergo, you are really prone to COVID infection. For water pipe users, that is in the Middle East, and even here we have, and what is the equivalent and most popular, the vape. Most often, the younger ones would share vape together. They will have clouds. They are in an enclosed place. And what are they producing? Aerosol. Diba? Ayaw natin ng aerosolization during the COVID pandemic. And so, using those e-cigs and vapes puts all the users and even their household at risk because there is such a thing as second-hand aerosol. The effect of coronavirus can be worse for people who use tobacco. Tobacco use leads to disease and disability. That the coronavirus attacks the lungs, and if your lungs are already damaged by tobacco, then the effects of the virus could be worse. And more so, tobacco affects the immune system, meaning you're less able to fight off infections. So, we urge this call. We have been using this call pre-COVID to let's have pushed our tobacco-free laws to have a smoke-free Philippines. Can you click this slide? Hello? So this is our advice to smokers about coronavirus. This is not ours, but it came from the United Kingdom. Stopping smoking helps improve heart and lung conditions, wound healing, and many other health conditions, which will all carry on at the same time as COVID-19. Stopping smoking remains the single most effective thing people can do to improve their and their family's health and even the environment, both now and in the future. So, next slide, please. We all very know that there is this upcoming vape. But is it safer? Analyze this picture. It is not just vapor. We call it an aerosol. It is a liquid suspended in gas with substances as volatile organic compounds, nicotine, ultrafine particles, even cancer-causing chemicals, the heavy metals like nickel, tin, and lead, and the flavorings themselves, when heated, can be producing diacetyl, which is linked to serious lung disease. So, next slide, please. Vaping is just new. It is 17 years in the market. But here are the things we have been seeing. The short-term health effects. Kids who are exposed are prone to allergies, asthma, pneumonia, even poisoning when ingested, burns and explosions out of that, short-circuited devices, and the long-term health harms of e-cigarettes produces nicotine addiction, chronic asthma, decreased lung function, pneumonia. We're seeing COPD in the young, and I hope you did not forget that the pre-COVID we have a case of E-Valley, and this is a gateway to smoking. And long-term use, this is deduced to have an effect in having cancer. So, vaping spreads COVID-19 faster. That aerosol that is produced by that device, which is being inhaled by the user, inhaled by the second-hand bystander, and even the third hand, because the aerosol sticks into the home, can carry that COVID-19 virus. So we urge everyone, please, let's regulate, and more so, to stop vaping now. Next, please. So, as your frontliners, your doctors, we always say, stay safe. Please, stop smoking. No vaping. This one should be in our new normal. So, we always say that the frontliners are the doctors, the nurses. The final slide, please. No, the frontliner now, in this time that we are opening everything, is actually us, the citizen. Please do not forget, before COVID, I call it BC, there are Philippine laws against smoking and vaping. That is the EO 26, that is ban on smoking in enclosed public spaces, ban on sale of cigarettes within 100 meters from school. That was enacted July 2017. Some LGUs have successfully implemented that. And with the threat of electronic cigarettes, in January 2020, before the COVID, there is this EO 106. It just updated the EO 26 to include ban on manufacture, sale of e-cigarettes to minors. And it has been approved as a Republic Act 11346 to raise excise tax on cigarettes by 45 per pack, incremental increase of 5 per year for 4 years to a total of 60 by 2023. And that 50% of tax is for healthcare. You can just imagine if we don't stop or we don't regulate this smoking, we don't push for a smoke-free Philippines, imagine the non-communicable diseases caused by smoking, and even the threat and the burden of COVID with the smoker and the second-hand smoker. So that RA 11467, raising excise tax on e-liquids and age of access to 21 years old, same time, January 2020. Let us not forget. Let us push this. Let us not repeal this law. and let us all push for a smoke-free Philippines. So with that, please remember this slide, this final slide. Okay, next. We all know the effects of tobacco. Those pictures on top are your frontliners. But what did I tell you? Now that we're opening up, we are trying to go back to our new normal. The frontliner are actually us, the citizens. Let's all start at home, in our office, the community, and in their country. If together we can always make this winning poster in 2017, what the children are saying, we want a smoke-free Philippines because this is a healthy haven for children. But for now, during our COVID times, we call it the DC, the smoke-free Philippines is actually one of our best steps to beat COVID-19 because having a smoke-free means better air to breathe in, lesser chances of getting COVID, and after COVID, definitely, this dream of our children to have a smoke-free Philippines will be a reality. Thank you.
Thank you, Doc Chris, for reminding everyone to keep the environment smoke-free in the new normal. The floor is now open for questions for Doc Chris. Doc Chris, we have a question from Aiko Miguel of UNTV. I'll let her ask her question po.
Yeah?
Go ahead, Aiko.
Yes, Doc. Good morning po.
Yes, hello?
Go
Apo.
ahead, Aiko.
Doc, as you mentioned, just like to ask, do you have a data kung ilan po sa mga positive cases ang tobacco users or smokers? At dahil sila nga po yung mas nakaka-experience ng severe na symptoms if ever hit by COVID. And we also have a data kung ilan po sa mga death cases po natin ang smokers. And as you've mentioned po, vaping spreads COVID-19 faster. So do we also have cases like this po na mas madami po yung positive cases na smokers or vapers po? Thank you, Doc.
Okay, the real data, I don't have it on hand now. I have been asking my friends in the COVID referral hospital, so I cannot give you a data on that. But if you're going to see the incidence of COVID-19 in the workplace, especially in call centers, unfortunately, it's an enclosed space, and in between their pastime is to smoke or to vape. So that's why we are not surprised that when the economy reopened in June and the people are coming back to work, especially in these enclosed spaces, more of our COVID cases are now reported coming from the workplace, and smoking per se has a big factor in that. Perhaps our DOH ASEC can shed light on whatever data they can share. I know they have mentioned this a long time ago.
Yes, Dr. Risa. Actually, we have no Philippine data as of now, but based on international evidences, it has been said that smokers are more prone to having more severe and critical cases of COVID-19.
So, but perhaps
We'll be moving on to
retrospective. So honestly, that
Go ahead,
the
Doc.
WHO Cochrane Medline is actually, that's a pooled data, and they have a hard time relating and compiling this data. But from China, United Kingdom, and even the United States, 8.5% among the COVID cases are smokers. Vapers, it has yet to be compiled, so this is actually developing. But based on the data I have shown you, the tobacco epidemic is there. The association between COVID and smoking is there. So this is our best time. Let us not wait for our numbers to explode, coming with victims from smokers and even the young, the vapors. While we have time, what is our dictum in medicine? Prevention is best rather than cure. And enacting our smoke-free laws will actually help us to beat this COVID-19. It is a sad fact that in Asia, we are almost number 2 in smokers. For the youth, we are number 5. Let's not wait for our data to blow up. Let us not wait to have concrete data to show before we step into action. That's why this DOH forum is very timely. Um, Aanhin natin ang data kung mas maraming bata o mas maraming matanda ang magkakaroon ng COVID o magkakaroon ng iba pang sakit. Samantalang aandito ang ating mga batas na handang itulong sa atin at i-implement sa local government. So para din yung meron bang law na wash your hands, wear your mask, watch your distance, it's actually we are implementing a healthy habit. So smoke-free, stop smoking, quit smoking. All the LGUs have a smoke-free community. In our homes, let's have a smoke-free home or a vape-free home. We don't need data for this. This is actually healthy lifestyle we are trying to push.
We hope that answers your question, Aiko. Let's move on to the next question from Red Mendoza of the Manila Times. Red, go ahead, ask your question.
Hi, good morning.
Good morning.
Aside po sa cigarette smoke, which is of course the most prevalent sa smoking, isa rin po natin sa dapat i-consider is yung smoke coming from plants, industrial plants, and vehicles. Paano po natin maiwasan yung ating mga vulnerable nating mga kids na ostensibly hindi po sila makakalabas right now, pero once na lumuwag na yung mga regulations sa paglabas ng mga minors natin, sila yung mas alam natin pinaka-vulnerable sa smoke when it comes to vehicles and plants, industrial plants. Paano natin may iwasan na mangyari na makalanghap yung ating mga minors, ating mga young people against this curse? Kasi in any case, hindi naman may mga instances hindi naman sila naka-experience ng smoke dahil yung family nila, community hindi naman nag-i-smoke, pero naka-experience sila ng smoke coming from public transportation or yung sa pagpunta-punta nila sa mga school. So how are we going to prevent from happening from this from happening po, Doc?
Okay, it has been before COVID we have the Clean Air Act. So this is actually we're calling on our local government unit to revive this Clean Air Act. That also includes burning of the leaves and our trash outside. And then even the smoke belching. And eto pa yung nakikita ko, we have so many motorcycles. And do you know that there is an association of increased asthma among children and even allergic rhinitis with increased use of motorcycle? So palagay ko this is actually part of our smoke-free kasi they are actually smoke belching, ano? So let's not forget we have all laws in place. It's actually the implementation. We have the Clean Air Act. And I know DOH has been very vocal on this a long time ago. So ngayon lang natin nare-realize we have the laws and we can always help implement it. So kung may nakikita tayo na ganyan, let's report it to our local government. Definitely, I think they also want to catch on them so that the community, the barangay will be healthier. Especially during these times. Thank you.
Thank you, Doc Chris. Last question po from Mikhail from AFP. Go ahead, Mikhail.
Hi, good morning, Doc.
Hi.
Doc, are you seeing a decline in terms of smoking prevalence or incidence because of the COVID pandemic and the way health authorities have communicated the associated risks of smoking with COVID? And second, you've mentioned also that the Philippines still has one of the highest incidence of smoking in the region, and
Yes.
despite the fact that we have implemented, stricter anti-smoking measures, especially under the current government. So, what kind of policy reforms do we still need to further decrease the incidence of smoking in our community?
Okay. The Philippines is actually part of the FCTC, the Framework Convention on Tobacco Control. For adults, we're getting good figures from 2011 Global Adult Tobacco Survey. It is 29%. Now in 2015, it has gone down to 23%. That's why during the time of Secretary, I'm not so sure, one of the tobacco control advocate, we were given an award by the WHO and that. But what is alarming with the Global Youth Tobacco Survey, the adult smokers are going down. But for adolescents, from 13% in 2011, it's going up. It is 16%. So, why is it so? Because the economy is improving. More families are affluent. So kids are having access. And do you know that the problem of this is our tobacco, cost is still affordable. Our laws does not have anything to control the tingi, no? So retail. So if you're going to divide, even if the tobacco is 100 and plus, but they can buy sticks as cheap as 20 pesos, that's so affordable. With the tobacco control warnings, no, meron tayong mga graphic warnings, wala na tayong advertisement. Ang nakakatakot kasi is online. So you see the magnitude of the problem, but we can always do something on that because we have the Empower, and DOH has actually fully implemented the Empower. We have the Monitor, we have the Protect because of the advertisement. We have actually quit lines wherein people can access that. And then raising tobacco tax. Actually, this is actually our battle. When we raise tobacco tax and even e-cigarette tax, the adolescents who are enticed by the industry definitely will be affected because adolescents are price sensitive. It is a long battle, but actually the DOH and other health advocates are into this. So that's why we are raising this call during this COVID time so that after COVID time, AC, we will have a better implementation of all of this Empower, all of our tobacco laws so that our country, community, and home is healthier, and that risk of getting another epidemic or pandemic will be lessened because we as a family and we as a citizens, it will be inherent in us that smoking and vaping should be in as part of our new normal. And what we call that, it should be our better normal. So I did not get the first question. Can you repeat it?
Can have some follow-up po, Doc Chris.
Doc, my first question is, are you seeing a decline in smoking prevalence because of COVID? And a quick follow-up to my earlier question, how much increase would you want to see for the tobacco, for the cigarettes? And how do we further limit access, especially to the young smokers? Kasi I think these are the ones targeted by the tobacco companies because it's a lifetime of customers, so to speak, once they get hooked to smoking.
The last law enacted in January 2020 actually is creating a big raise in the tobacco tax and that of the e-cigarettes. And we're just waiting for its implementation. And it was just put to stop because it was January 2020. And hopefully our legislators will not repeal it because once implemented, and also, by the way, the FDA is taking its step in regulation of our electronic cigarettes and not of the Department of Trade and Industry. Why? Because of the lessons learned from the US e-cigarette epidemic. So we're just raising this call that we have the laws. Let us just be aware. Let us all cooperate because we can achieve this dream of having a smoke-free Philippines. So that's it.
All right. Those are all the questions for Doc Chris. Doc Chris, thank you po for accepting our invitation and for reminding the public to keep smoke-free in the new normal. Salamat po, Doc Chris.
Thank you, thank you.
We will now be moving on to the regular media forum with Yusek Rosette. Yusek Rosette, let's start po. We have a few questions that is related to vaccine czar. I'll read po the question of Neil Jerome Morales of Reuters News. Secretary Galvez was appointed the vaccine czar. What specifically will he work on? Any changes on the vaccine evaluation, tests, and procurement processes?
Good morning to all of you, and I'd like to thank Dr. Gonzalez first before we start. Maraming salamat po, Doktora. Thank you for accommodating the invite of the Department of Health. So as to the vaccine czar, unang-una, katulad nga ng sabi namin, we welcome this assignment for Secretary Galvez. Wala po tayong babaguhin sa ating mga proseso just because Secretary Galvez was assigned as the vaccine czar. All the processes would still be continued. Ito po lang ay magkakaroon ng additional na makakasama natin at magli-lead sa atin para po sa ang kanyang mga specific tasks to handle would be the purchasing, the negotiations, the manufacturing, production, and distribution of the vaccine. Of course, si Secretary Galvez will not work alone. He will still work with us, the Department of Science and Technology, Department of Health, DTI, DOF, DFA, at Bureau of Investments, at yung iba pa hong ahensya. Katulong po natin siya ho ang magli-lead sa amin. But definitely the procedures and the processes in place would still be followed. Yun pa rin po ang gagawin natin. And most importantly, yun pong ating regulatory process to ensure that these vaccines would be safe and efficacious ay pagpapatupad pa rin natin. So no processes will be changed. Madadagdagan lang po siguro because we now have this vaccine czar, our leader, baka mag-a-add siya ng more expeditious ng mga proseso para mas mabilis po tayo.
Thank you, ma'am. Next question po from Red Mendoza of the Manila Times. Have we established a contact with the DOH health facilities that were affected by Typhoon Rolly? With Shawnee approaching the country, has the DOH made the necessary prepositioning on those areas expected to be affected?
Yes, Red, So it's something that the Department of Health regularly does, Kapag meron po mga parating, hindi po natin naantayin na dumating na at nakapinsala na bago tayo mag-preposition ng ating mga logistics for our regional offices. So nakahanda po tayo, kagaya po nung sa Typhoon Rolly, nakahanda rin po tayo, and we were able to provide additional funds already. We were able to provide logistical assistance to these different regions who were affected, and we are continuously assessing. So nung una, nagkaroon tayo ng problema kasi na-cut off ang line dun sa ibang areas. Kaya hirap na hirap po tayong maka-contact sa kanila, makapag-coordinate with them. But now that lines are open already, mas naging madali na para sa atin na ando na yung mga ibang tao natin dun sa affected areas. Our regional offices were mobilized as well as with the other partners that we have, development partners at saka po yung mga private partners natin na ando na po lahat dun sa mga napinsalang mga lugar at nagbibigay na po ng kanilang tulong. As to Typhoon Shawnee, we already were able to preposition logistics, Hindi lang po nung para sa Typhoon Rolly, ito po yung para sa lahat na ng ating mga regions na meron tayo. They always have this buffer preposition po yan anytime that there would be a calamity that na magkakaroon sa isang lugar. So nagkaroon ho kami ng prepositioning of logistics, and we were able to provide 31 million worth of supplies, drugs, medicines, health kits, at saka kasama na po dyan yung PPEs na ibinibigay natin sa ating mga tao, and COVID-19 supplies also for the different CHDs. Meron din ho kaming pinamigay meron din ho kami nakastock ngayon na nakaayos na for distribution, 21 million worth of commodities pa additional. So as to financial assistance, I have mentioned to you a while ago, we were able to provide 20 million pesos already to different facilities dun sa affected areas. We can give you the breakdown later sa Viber group, Nick, yung table natin. We can just provide it.
Next question po from Gabby Parlati of the Daily Tribune. Given that the DOH has estimated damages of up to 116 million on affected health facilities by Typhoon Rolly, what is the department doing to augment these losses, especially still with the existing threat of COVID-19? Does this mean that testing for the region will be hampered? And if so, what is the estimated number of samples that will be affected?
when we check, no, so as we have mentioned, meron tayong laboratory that was affected by the typhoon. And it is not just the laboratory that we look at, no, especially yung mga disease reporting units natin kung saan nangyayari minsan yung mga swabbing natin. Tinignan natin. And as of our, based on our reports, no, November 1 and November 2, we still have received, no, reports coming from these different laboratories that were affected by the typhoon. So meaning they still continued on with their operations. Although ngayon, tinitignan natin kung makakapagpatuloy tayo ng kanilang operasyon ng in full capacity. Although November 2, we were not able to receive specimens in this some laboratories in the affected areas, and we were assuming na because people also were affected, kaya hindi po masyadong pumasok ang mga specimens. We would like to just caution, kung meron hong magtitigil ng operasyon sa mga labs because of this effect ng Typhoon Rolly, bababa po ang output natin, pero makikita natin yung pagtaas niya as soon as na maging operational na uli ang mga laboratory. So as of last night, we were trying to get the laboratories which stopped their operations and which has resumed at once and which up to now, hindi pa rin po nag-ooperate. So magbibigay tayo ng report mamayang hapon ukol dito. Nick?
Thank you, ma'am. Caroline and Greg have related questions with regard to UP Octa research. Caroline asks, Octa researchers are concerned that Makati, Malabon, Baguio City, Itogon, and Tuba, Benguet, Lucena City, Iloilo, Catarman, and Pagadian may experience high hospital burden in the coming weeks that may stress their healthcare systems and overwhelm their medical frontliners. They identify these LGUs as high risk. Mataas na rin po ang hospital occupancy rate. Paano po i-manage ang cases doon sakaling dumami pa ang kaso na kailangan mo ospital? Given na in most of those areas, magkakalayo po ang ospital o malayo ang nearest hospital from another province or city.
Okay, Caroline, and I think Greg also has a similar question. So unang-una, kailangan natin balikan yung ating how we measure kung tumataas at yung kaso, paano natin ina-analyze and how do we correlate this with other factors. Sabi natin, pag tumitingin tayo ng numero sa isang lugar, kailangan kinokonsidera din natin yung health system capacity ng isang lugar. So for example, tumataas man ang kaso nila, pero kung ang kanilang healthcare utilization is manageable, we strictly monitor, pero hindi po natin yan ipagbibigay na we are not going to say na this area has been overwhelmed already or nearing this point na mau-overwhelm na sila. So lagi po natin tinitingnan yung importansya ng health system capacity. So kapag tinawag po natin, sinabi natin it's the attack rate, yung mini-measure natin na average daily attack rate, ang atin pong ideal would be less than 1 per 100,000. Kapag ka naman dun sa isang measure na ginagamit natin, yung 2-week case growth rate, ang atin pong ideal is for us to have a negative 2-week growth rate. Ibig sabihin, for the past 2 weeks, comparing to the current, walang naging pagtaas ng mga kaso doon sa lugar na yon. So, dito sa mga sinabi ng Octa, yung Makati, yung Malabon, yung Baguio, yung Benguet, Lucena, Iloilo, Northern Samar and Zamboanga del Sur. Ito po ay sinasabi nilang more than 1, ang kanilang ADAR or yung average daily attack rate. And that is the same naman po dun sa analysis namin. But when we look at their occupancy rate with their healthcare utilization, for example, in Makati, ang kanilang occupancy rate mataas. Pero pag tinignan po natin, ilan lang ba ang ospital sa Makati? Meron lang po tayong 3 na lisensyadong ospital sa Makati at doon naman po sa Lucena, meron lang po tayong 5 ospital. So kailangan po may further analysis na ginagawa kapag ganyan. Kailangan din natin tignan how many or how much did the city or the province has allocated for COVID beds para masabi natin na pag sinabi nilang high ng occupancy, it is really rational and valid na sinasabing yung kanilang 30% na inallocate or 25% na inallocate or 20% na inallocate for COVID has already been utilized or nearing full utilization already. And as I've said, we have to consider also how many hospitals do you have in that specific city. Kaya nga po yung one hospital command with this kind of situation that we have right now is very appropriate because even though, for example, Makati only has 3 hospitals, kapag ka nandun na siya sa point na medyo nagkakaroon siya ng danger zone, na ililipat po natin ang mga pasyente o na i-refer natin sa ibang mga karatig lungsod para po makaagapay po itong city. So yun pong iba pa nating mga growth rate at saka average daily attack rate, we will be providing you with a table later. We're able to analyze already. So ibibigay po namin yan sa inyo mamaya sa Viber group. And then for the reproduction number, yung sinasabi ng Okta, they reported 0.81 and then 0.86 for October 25 to 31. So it's still less than 1 pag tinignan po natin yan. And that is still the ideal. We need to correlate this now with the number of new active cases that are being reported. At pag tinignan po natin ang ating datos and the trends that we are having, bumababa po talaga ang ating mga new cases na naitatala sa iba't ibang lugar, especially those areas na talagang closely monitored natin. Nakita po natin yung sa NCR, sa Region 7, sa Region 4A, na talagang bumaba na. And overall, the Philippines has been able to have that 25% decrease in the reported new cases for this past week. So, titignan lang ho natin this correlation. Hindi po pwedeng we're just taking one indicator na siya lang. No? Kailangan i-correlate po natin doon sa ibang mga important indicators that we are also using for COVID-19. Nick?
Thank you, ma'am. Those are all the questions submitted yesterday. Ma'am, do you still have time to accommodate a few from the chat box?
Okay.
Let's start po with Caroline Bokin's question. Secretary Roque said that the whole country may be placed under MGCQ by January. Ineko lang daw po niya si Yusek Vergere. May we know exactly what is the DOH recommendation on this? And basis po, bakit MGCQ kahit may mga uptick pa rin ng cases?
Katulad ng sabi namin, lagi namin pinapaulit-ulit for these past weeks, sabi natin, meron tayong gatekeeping indicators and we already have set targets and milestones. Ang sabi natin, itong gatekeeping indicators natin, this is your efficient surveillance system, efficient contact tracing, yung mga tao nagmi-minimum public health standards at nakakapag-enforce tayo sa local governments natin. So sabi natin, if only local governments will be able to achieve these gatekeeping indicators by the end of December, we have set that targeted milestone. By the end of the first quarter of next year, all local governments, hopefully, will be at that MGCQ stage. Kasi kapag nagawa mo na yung na-achieve mo yung gatekeeping indicators mo, you were able to do all of this local actions na kailangan, mape-prevent mo ang further transmission. That's why we have that milestone, but that by the end of the first quarter of next year, 2021, lahat ng ating mga local governments will be able to shift to this MGCQ. So Caroline, yung sinasabi mo na meron pa ring pockets of infections or clusters na nakikita natin, and that is true, Pero sabi nga natin, kung tayo ay makakapagsagawa nitong mga kakayanan ng local governments, fully by the end of December, hopefully, ang hope natin, by next year, makikita natin itong mga pockets na mga may clustering tayo, mawawala din yan. Kaya nga ang ating target, by the end of first quarter next year, MGCQ na lahat ng local governments, so all of us can shift to this new normal that we are saying.
Thank you, ma'am. Next question po also from Caroline. Dr. Tony raised the concern over having a military man as a vaccine czar. He pointed the need to have experts to oversee the vaccine approval, production, and distribution in the country. He said there should be a vaccine advisory committee to provide independent advice in the crucial steps that need to be taken. How important is it to have health experts such as vaccinologists in the oversight committee?
Very important, Caroline? Alam mo, katulad ng sabi ko kanina, it's not because Secretary Galvez was appointed as the vaccine czar, siya lang ang magtatrabaho dyan. Nandyan pa rin yung mga proseso natin. Nandito pa rin po kaming mga national government agencies to support him and to follow his lead. Nilagay lang siya dyan para mas magkaroon tayo ng more expeditious at saka more efficient manner of doing all of these things that we need for the vaccines that nadadalin dito sa atin. So hindi po mawawala yung mga proseso natin na currently ginagawa natin. And currently, we already have a lot of experts helping us. Meron na po tayong vaccine expert panel ng DOST. Meron po kaming technical advisory group members ng DOH. Meron din po kaming mga vaccinologists sa iba't ibang mga scientific institutions na pwede nating itap. So this would still be a whole of government and a whole of society approach. Hindi lang po si Secretary Galvez ang magtatrabaho naman. We will help him, we will support him. Ang buong gobyerno po ay tutulong sa kanya, kasama na po yung mga iba nating partners.
Thank you, ma'am. Next question po from Aiko Miguel. Kapag tag-ulan ba at malakas ang hangin, ano po ang epekto nito sa virus? Advantages ba o disadvantages o epekto ng weather sa transmission ng COVID? Kapag prone ka sa ubot-sipon ngayon, mas prone po ba sa COVID? Paano ngayon na madaming magkakaubo at sipon? Dapat magpa-test po ba sila because they are suspected COVID cases?
Aiko, unang-una, kailangan balikan natin, how is COVID-19 virus transmitted? Sabi natin is through droplet infection. So, hindi siya airborne na kapag nandyan yung malakas na hangin, dahil bigay ng bagyo, ay magkakaroon ng increased transmission. Although up to now, wala pa pong ebidensya na makapagsasabi that based on evidence, the weather affects the transmission of the virus. Like, for example, kung mainit, namamatay ba yung virus? Kung malamig, mas lalo ba siyang nagpo-propagate? Ang meron lang tayong mga ebidensya ngayon, sinasabi kapag ikaw ay nasa enclosed setting, the virus may stay longer. Kaya sabi nila, maaring maging airborne kapag ikaw ay nasa enclosed setting. So if there are storms like this, yung mga bagyo, pumapasok tayo lahat sa loob ng bahay natin, di ba? We don't stay outside because of the strong rain and winds. So that might be a cause, kung sakaling merong isa sa household natin na may infection. Kaya nga po ang patuloy naming paalala, yung minimum health standards natin. Hindi porket nasa bahay tayo, hindi na tayo mag-mask, hindi na rin tayo mag-physical distance. We still need to do this inside our homes para mas protektado po tayo. As to those with ubot-sipon, madalas magka-ubot-sipon, ang lagi natin sinasabi, there are vulnerabilities dito sa sakit na ito. At ang sinasabi nga ng mga ebidensya, kapag ikaw ay immunocompromised, for example, or ikaw ay meron kang kahalong sakit, like for example, you have asthma, kapag ka mga changes in weather, itong mga tao may asthma, madali sila magkaroon ng mga atake. Maaring ganyan. So mas vulnerable sila, mas dapat binabantayan at pinoprotektahan sila. Pero kailangan din natin isipin, Aiko, bagamat dadami ang mga may ubot-sipon dahil ito yung panahon talaga nitong mga ganitong sakit, kailangan natin isipin, di ba pag COVID-19, hindi lang simptomas ang tinitignan natin, kailangan natin isipin at tignan, may exposure ba yung tao para mas nagiging efficient tayo sa pagmamanage natin ng mga kaso. Kung ang isang tao ay lumabas, nagtrabaho maari, pag-uwi, umuubo at sinisipon, maaring mataas ang high index of suspicion natin dyan. Pero marami sa atin na nananatili lang sa bahay pero nagkakaubot-sipon pa rin sa mga ganitong panahon, maaari lang obserbahan muna natin ang sarili natin and we just implement the minimum health standards, wear mask at home para makita natin kasi yung likelihood na meron silang COVID-19 mababa dahil walang exposure. Nick?
Thank you, Yusek. Last 3 questions po. We have 2 from Rafael Bosano, also related to a vaccine czar. Question. Vaccine czar Secretary Galvez said that the immunization plan is to give 2 doses over a 3-week period. Does the DOH agree with this time frame? How were new vaccines introduced in the past? Will the COVID-19 vaccines follow the same protocol or will the processes be expedited given the urgency to vaccinate a large portion of the population?
Yes, Rafi, yun pong sinasabi ni Secretary Galvez, tama po yun. Karamihan, but not all vaccines that are out in the market have 2 doses, Ito po yung first and second dose. Bakit ba tayo nagbibigay ng 2 doses? Kasi yung ibang bakuna, ma-achieve mo lang yung required, or desired pala na effect niya sa katawan mo kapag 2 doses, You reach that kind of effect in your body kapag 2 doses. So sinasabi nung mga ebidensya at saka sa pakikipag-usap natin, 21 days ang talagang sinasabi nila na interval between the first and the second dose. As to the introduction of new vaccines, kung pareho pa rin na gagawin natin as to distribution and all, may mga konting pagkakaiba dito, Rafi, Katulad nung binabanggit nila kung sakali na tayo ay pipili ng mga bakuna na kailangan ng ultra low freezer, may iba ang distribution system natin when that happens, no? Hindi porke hindi pa tapos ang clinical trial nung iba, hindi na tayo pwede magsimula. Kasi meron na pong mga bakuna na internationally approved already, tapos na ng clinical trial na nag-o-offer na rin sa ating bansa. So pag pumasok yung mga bakuna na yan dito, it is not for clinical trial but for use already. So meron ho tayong dalawang sets na tinitignan ngayon. May mga manufacturers and bilateral partners po tayong kausap kung saan yun pong clinical trial ay isasagawa natin dito sa ating bansa. Meron naman po tayong isang set na tinitignan na ayaw na po ng manufacturers to undertake clinical trials here in the country. They want for the country to procure already. So tinitignan din po natin yan. At lahat po yan ay pinag-uusapan naman, and lalong-lalo na ngayon, meron na tayong vaccine czar. We will be discussing this para makita po natin ano yung mga options for our country kapag ginawa natin yan. We had been implementing the National Immunization Program for decades already. So meron na ho tayo talagang existing na sabihin na nating expertise, when it comes to the distribution, when it comes to the storage, when it comes to the implementation of vaccines. Wala po tayong mamadaliin. Alam natin, this is kind of urgent, but all of this would still undertake or undergo the usual regulatory process para lang po masiguro natin na ito ay ligtas at ito ay makakapagbigay ng desired na effect natin sa ating population. Meron ho tayong dinagdag na extra precaution nga. We have invited vaccine experts para po aside from the registration of FDA, we can rely on them para magkaroon ng evaluation, further evaluation to see kung talagang nararapat itong bakuna na ito na bibili ng ating bansa para sa ating populasyon.
Okay. Thank you, ma'am. Next question po from Rafael. The typhoon has forced a lot of families to seek shelter in evacuation centers. While officials say that health protocols must still be followed, it is inevitable that people may sometimes forget or disregard. How does the DOH see this affect cases of COVID-19 in the coming weeks?
Well, this is something that we have anticipated, na parang nandun na yan sa mind natin, kasi it's reality actually, kapag nagkakaroon tayo ng mga ganitong kalamidad, nagkakaroon tayo ng evacuation, hindi natin maiwasan na meron talagang mga lugar na hindi makaka-comply with this distancing and all. So kaya nga ang sabi natin, pinaka-importante at kabilin-bilinan at talagang nag-monitor kami, kailangan may safety officers tayo dun sa ground. Yung mga safety officers to monitor if the evacuees are complying with the minimum public health standards that we have set, and also monitoring people who are developing symptoms so that we can easily extract them. So ito naman po atin pong pinaglaanan ng mga advisories, ng mga pagpapaalala sa ating mga local governments para pa naman po hindi dumami ang infeksyon. So titignan po natin ang epekto nito in the coming weeks para makita natin if there really has been an effect on this kind of circumstances na pwedeng ikataas ng ating mga kaso ulit. Nick?
Thank you, Yusek. Last question from Joe Vicky of Enquirer. Secretary Galvez said that based on the government's 7-point immunization plan, the evaluation and acquisition of a potential vaccine should be completed by the year end. Is this even possible when trials are not expected to start in December as the earliest? Can DOH also provide details about the initial talks with AstraZeneca, Zuellig Pharma, and Unilab?
Yes, Jovic, itong katulad ng sabi ko kanina, hindi naman, we are looking at two sets na mangyayari or mechanisms dito sa ating bansa. Yung isa, yung for the clinical trials, yung isa naman, yung talagang ready to procure na. Marami na pong mga manufacturers ang nakapag-set na at sinasabi nila tapos na sila by November, actually dun sa kanilang mga clinical trials at pwede na kayo makipag-negotiate with them. Actually, starting already, they have offered to us already. So hindi porke hindi pa tapos ang clinical trial, we cannot procure from the other manufacturers. Ang ginagawa lang po ng ating gobyerno ngayon, pinag-aaralan po natin lahat ng nasa advanced stages nung sa vaccine development. Tinitignan natin what would be most appropriate sa setting natin, sa existing resources natin, at saka ano yung pinakamabilis na pwede nating makuha para sa ating population. So we already have drafted our vaccine implementation plan kung saan nandiyan na po lahat ng considerations na yan, na andyan na rin po yung assumptions natin based on science, and also nandiyan na rin po yung ating plano for operation. So yan po ay nabuo na natin. Gagawin na lang natin ay magkukonsulta tayo sa ating mga partners and stakeholders para matapos po natin yung implementation plan, and we can share to everybody regarding this matter. As to the 3 manufacturers that you have mentioned, lahat po yan ongoing pa rin ang mga discussions natin ukol dyan. Kapag nagkaroon na po tayo ng mas konkreto, no, na mga pag-uusap sa mga manufacturers na to, we will give information. But for now, it is still too early to give you concrete information regarding this. Nick?
Those are all the questions for today, ma'am. Your final message po before we end today's forum.
Yes, sa pagtatapos po nitong forum natin, gusto lang ho namin magpasalamat uli kay Dr. Rizalina Raquel Gonzalez. Siya po yung head ng Tobacco Control Advisory Group ng Philippine Pediatric Society sa pagbabahagi po ng kanyang kaalaman and of course experience with regard to tobacco control and how it relates to the current pandemic right now. So ang maprotektahan at gawing malusog ang bawat Pilipino ay layunin din po ng ating mga immunization program. So gusto ko po uling ipaalala sa inyo that we have this campaign for immunizing children below 5 years old hanggang November 25 po ito. Kami po ay natutuwa at ang ating mga efforts sa immunization ay nabanggit po at kinilala ng World Health Organization sa pamumuno po ni Director General Tedros Ghebreyesus. Pinangarangalan po ang DOH. No? We were recognized sa ating maagap at coordinated na polio outbreak response noong September 2019. Nakapaghatid din po ang DOH ng mga kinakailangang bakuna na sumisigurong ang bawat bata ay mapoprotektahan laban sa polio. Ang immunization efforts na ito ay aming naisagawa sa tulong po ng ating mga healthcare workers on the ground na nagsusumikap para maihatid sa ating ang health services na ito, pati na rin po sa cooperation ng ating local governments at ang ating mga community na yung mga tao natin sa komunidad. So tuloy-tuloy po ang ating mga immunization programs sa kapila ng pandemya at sa kabila ng Typhoon Rolly. Matutuwa po kayo na malaman na nagpatuloy pa rin po ang pagbabakuna pagkatapos ng typhoon, ano? And even during the typhoon, yung mga hindi naman ganun kaapektadong area ay nagkaroon din po ng pagbabakuna. So nagpapasalamat po kami sa ating mga healthcare workers sa lokal dahil po sila naman po ay yung commitment nila for immunizing our children are there. So patuloy pa rin po ang Chikiting Ligtas MROPV supplemental immunization activity sa pagbibigay po ng MROPV vaccine sa mga batang less than 5 years old upang maging protektado laban sa rubella, laban sa polio at laban sa tidas. Ito pa rin po ay nakapaloob sa Universal Healthcare Law na naglalayong na ang healthcare services ay dapat mabigyan ang bawat Pilipino. Sa kabila po nitong pandemya na hinaharap natin, sa mga kalamidad na ating hinaharap katulad ng Typhoon Rolly, o kahit anumang sakuna, patuloy pa rin po ang pagre-responde at paghahatid ng karampatang tulong pangkalusugan upang masigurong ligtas at malusog ang bawat isa sa atin. So thank you very much po, and we will see all of you on Friday for a regular media forum. Thank you, Nick.
Thank you, ma'am. Salamat po to everyone.